Thank you so much for agreeing to be patients for Dr. Parkhill and I. It really helps us a lot. So this will be for Thursday patients. You will be Judy Evans. You experienced a stroke resulting in left-sided weakness, so you're going to have difficulty with your entire left side. I'm going to present to you how I want you to look when the therapist is moving you. So when they're going to be moving you in the bed and when they're going to sit you on the edge of the bed, this is how I want you to look. So I want you to be, your left arm to be a little bit flexed like this, and I want you to be slumped over to your left and your pelvis area to be pushed forward. So like this, okay? So again, lean. When the therapist asks you if you can move this left arm, you can give a little bit, and that's about all you can do. So make sure, again, you're positioning yourself in this position. In regards to your right side, no issues. You can just move it normally, okay? But again, you're slumped over. We would like you to kind of keep that position throughout the movement, regardless of what they're doing, because the therapist is supposed to be then correcting you and putting you back into center. So the way that this is going to work is a therapist is going to walk in while you're in bed. They're going to ask you questions about, it's called prior level functioning, so what you were doing prior to this injury. They're also going to ask about your home setup. All of that information is on your cheat sheet, so just refer back to that, and you can keep it with you during to make sure that you're kind of following the script. Once they do that, they're going to probably do some bed mobility with you. They'll sit you on the edge of the bed. They might do some things with you there, some assessments, or try to, fix your pelvis or fix your left side. Then after that, they're going to transfer you into a wheelchair. They're going to be doing different assessments. They're going to be doing activities of daily living with you. So they might do dressing, grooming, hygiene. It's going to be up to what the therapist wants to do and wants to see you do. The biggest thing is what we need you to do is to maintain that slumped and kind of slightly bent position of the left arm. We need you to have difficulty with responding to the therapist. So you should be able to understand what's going on, but have difficulty with responding back to them. You can be slow. You can maybe have some difficulty trying to respond back. And in general, please have difficulty doing everything. So regardless of what you're doing, have difficulty with it. When they're physically moving you, be a little bit of dead weight. Have some difficulty physically moving yourself. If they ask about pain, just say you have 4 out of 10 generally. You don't have a specific location, it just hurts everywhere. Other than that, please just keep your script with you and you can kind of just follow it. If you get lost, it's no problem, just refer back to that. But again, thank you so much for agreeing to be our patients, and we'll see you in the room.